The Guilford Press, in association with Riverside Digital Productions, presents Psychoanalytic Diagnosis: Understanding Personality Structure in the Clinical Process, 2nd edition, by Nancy McWilliams. Narrated by Allison Posner. Published by the Guilford Press, a division of Guilford Publications Incorporated. Audiobook copyright 2024. 2nd edition copyright 2011. Publisher's note: thank you for purchasing this Guilford Press audiobook. This title has supplemental material which includes the table of contents, suggestions for further reading, appendix, and references, among other resources. To download the PDF, go to the following URL: www.guilford.com/McWilliams-audiobook. Preface. When I originally wrote Psychoanalytic Diagnosis, I knew from my experience as a teacher that students and early career psychotherapists needed exposure to the inferential, dimensional, contextual, biopsychosocial kind of diagnosis that had preceded the era inaugurated by the 1980 publication of the 3rd edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-3, of the American Psychiatric Association. In particular, I wanted to keep alive the sensibility that represented decades of clinical experience and conversation in which human beings have been seen as complex wholes rather than as collections of comorbid symptoms. I also saw how confusing it was, even to psychodynamically oriented students, to try to master the bewildering diversity of language, metaphor, and theoretical emphasis that comprises the psychoanalytic tradition. The need for a synthesis of the sprawling and contentious history of analytic theory, as it pertains to understanding one's individual patients, was evident. In the early 1990s, I was also nourishing a faint hope that the book would have some influence on mental health policy and on our culturally shared conception of psychotherapy, which were beginning to be transformed in disturbing ways. No such luck. The breadth and depth of change since then have been stunning. For a host of interacting reasons, psychodynamic, and even broadly humanistic, ways of understanding and treating people have become devalued, and the likelihood that a patient with significant character pathology, the hallmark of most psychodynamic treatment, will find genuine, lasting help in the mental health system has, in my view, plummeted. As the cognitive behavioral movement continues to develop, some of its practitioners have become as upset with these developments as analytic therapists have been. My CBT-oriented colleague Milton Spett recently complained, in reaction to this trend, "We treat patients, not disorders." Political and economic forces account for much of this change. See Mays and Horwitz, 2005, for the political history of the paradigm shift in the area of mental illness, from broad, ideologically defined entities that were continuous with normality to symptom-based, categorical diseases. At least in the United States, corporate interests, most notably those of insurance companies and the pharmaceutical industry, have sweepingly reshaped and thus redefined psychotherapy in line with their aims: maximized profits. In the service of short-term cost control, there has been a reversal of decades-long progress in helping individuals with complex personality problems, not because we lack skill in helping them, but because insurers, having marketed their managed care plans to employers with the claim that they would provide comprehensive mental health coverage, later declined arbitrarily to cover access to conditions. Meanwhile, drug companies have a substantial stake in construing psychological problems as discrete, reified illnesses,
Sample complete. Ready to continue?